Soaring health care costs are hurting family budgets and the national economy. Collectively, Americans spent $253 billion a year on medical bills in 1980. Today, we're paying over $2.4 trillion.
In 2000, if your family received health insurance through an employer, you paid about $6,800, which 9 years ago was about 13.5% of the median family income. If you had the same insurance last year, it cost you almost $13,000, an 87% increase.
Earlier this week, Consumer Reports released a poll that underscores how dramatically escalating health care costs are affecting American consumers. Nearly 3 out of 4 respondents, 73% of the respondents in the Consumer Reports survey, said they worry that an illness or accident would be financially devastating to them. An equal number worry that if they get sick, they'll be denied care or have their care rationed by the health insurance companies. And nearly 3 out of 4 worry that they won't be able to afford health care in the future. Those are devastating numbers.
14,000 people woke up this morning with health insurance and will go to bed tonight without it. In the greatest country in the world. That is absolutely unacceptable. And we are now poised to do something about it for the American people.
Democrats have offered a plan to fix our ailing health insurance system in a cost-effective way that will protect consumers, preserve choice, and provide families with more options for coverage and greater access to health care insurance. Reform continues to garner support, broad support, from former Republican Senate leaders like Bill Frist, Bob Dole, and Howard Baker, as well as Republican leaders outside of Washington, like Governor Arnold Schwarzenegger. But the current congressional Republican leadership seems more interested in, quote, breaking President Obama rather than helping to fix a broken system.
During the long hours of debate on amendments in the Finance Committee, not once did our colleagues on the other side of the aisle offer a plan. The status quo our Republican colleagues are trying to protect is a health insurance Ponzi scheme. Health insurers collect ever-increasing premiums from innocent people who want only to invest in the health care of their future, protect themselves and their families from catastrophic illnesses and bankruptcy. And then the same insurers do everything in their power to minimize their own risk, finding a way to pay benefits only when absolutely necessary.
You ought to get what you're paying for. If you get sick, you ought to know that your health insurance will actually be there, and that they can't stop you because of a pre-existing condition for yourself or your family. All of the efforts that people go through every day now with their insurance company, we need to bring accountability to that system, and that's what this does.
The fact is, many Americans are one pink slip away or one major illness away from losing their coverage, and the American consumers need and deserve comprehensive, effective health care that cuts costs, that is affordable, that has access for all.